Okay, back to my video. I had to get a replacement on my humidifier from Amazon, but I was trying to get a refund and they wouldn't do that. But it would have been more financially beneficial for them to just refund me. Anyways, point is, so I think I must be, I don't know, I think, I wonder if my role is to be like a change agent for nurses or the way the medical system is, you know? And that seems overwhelming. It seems overwhelming to do that, but I guess this is the way I might do it. I might speak truth about what's going on in the hospitals and how nurses are treated, and that trickles down to the patient. So let me give you an example. I have 6 patients. Of course, I said earlier it's really been mandated for 5 by the American Board of Nursing. Of course, it's never followed. Sometimes they give the nurses at our hospital 7, if not 8 patients. And the acuity of patients is so much higher than it used to be in the old days, probably, when they even made the rule for 5. But yeah, I mean, these people have multiple problems, multiple system problems, and they're on so many drugs. So I walk in a room with my arms full of medicines for this person, not just oral medicines, but like IV antibiotics, IV push steroids. Some of it's IV Benadryl, IV pain medicine. So you got to make sure you get their vital signs first. So you don't want to give IV pain medicine to somebody who has got really low blood pressure or low pulse or low oxygen levels. And then, of course, you have to know what their blood pressure is or their pulse is before you give certain cardiac meds, blood pressure meds. And you also ideally need to do an assessment on this person. So all the while, you need to do this in the room. You get there, and the techs are overwhelmed too. They have so many patients, like 16, 15 patients a piece. Like they can't be everywhere at once. Always. I need to go to the bathroom. And nobody can freaking walk in the hospital. So you have to like help them walk to the bathroom. You have to set all your drugs down. Put your vital sign machine aside. Hang your stethoscope up because you're lucky if you get to use that. All the while you have five other patients and those lights are going off too and they need this and this person's throwing up, this person's in pain. I need to speak to somebody now. This is happening in this one room. So you get them to the bathroom. It takes forever, and then, then it takes forever for them to go to the bathroom. You have to help them get up. Hopefully you don't hurt your back. There's no help anywhere else. And oftentimes now our hospital is doubling rooms, which originally was a HIPAA violation, but they're doing it again. I understand in crisis situations that's needed, but I don't know if it's crisis. I think it's just greed, and we tolerate it. Patients tolerate it until another person posts online the HIPAA violation of this, and then they'll stop doing it for a while, which our hospital did for a while, and then they're back to it. Anyways, so you get them back to bed, and then they say, I'm in pain. Of course, you didn't get that in report. They didn't say that when you went into the room. So now you know in the back of your mind, you got to go get pain medicine. Or I'm nauseous, and you didn't know that. So you have to go and get nausea medicine too. So you proceed to do their vital signs. I don't know, maybe something's off, like their blood pressure is too low, and so you're like, you really can't have pain medicine. So then they get all pissed off and irate and upset. So you have to call the doctor, let them know. Any vital sign that's kind of alarming, I always let the doctor know. You don't call them, you text them. If you're lucky to know which doctor you have, because a lot of times they don't assign themselves, or they're not online, or they're not even at the hospital yet. So I just use my nursing judgment and I hold stuff. There's also IV Lasix that we push too. So you can't push that if their blood pressure is too low, and you have to let the doctor